These are the interesting, hands-on series which I will be teaching the students. We have Naren here. So Naren, this is an 82-year-old man, a frail man, presented with fever, cough, dyspnea. His oxygen requirement is very high. He's he's a RT-PCR positive. His COVID with respiratory failure. As far as the markers are concerned, the CRP is more than 200. All the markers are high. His hemoglobin is low. He has a high urea and a little higher side of creatinine, and with a high pro-BNP. He's on 4 to 6 liter of oxygenation. He's in ICU 4. Now I'll just explain you what are the changes. Very interesting. Now when the COVID hits the lungs, these are the changes you should look for as a student because of inflammatory. Now what we are showing here, Naren, just point out into ground glass appearance. Just show what is these are our ground glass. Now what you typically see is that I'll show you how does a ground glass, the way you break a glass bottle, that is the look here. You see this typically ground glass appearance. So ground glass opacity, what we call ground glass opacity, GGO. So this is the hallmark of COVID. And whenever you have a patient coming with a fever and RT-PCR issue, this is the first thing. And you see most of the lungs are involved, all the lobes, more than 80% are involved. And how we classify severity, we map in all the lobes and accordingly. This is number one. Number two, if you see very carefully here, and if I show you here, there are certain emphysematous, cystic changes. These could be a Bullock changes. These are also, pneumothorax, bullous changes are also. This is very unusual here, which has also been seen. Maybe he has a pre-existing emphysema, we don't know, but these are also changes we have seen. We have to compare with the previous CT. Now this is one thing. Now the second thing is that if you see the CT, no, not here, put the mediastinal window. In the mediastinal window, what we are seeing is that, very interesting, there are bilateral pleural effusion, you see, there are pleural changes done.
Yes.
You see, there are pleural changes, the calcified aorta also we have there, maybe old changes. So we have, so whenever maybe, these people, we are getting fluid overload also. We have to see whether it's either because of COVID or because of secondary changes, because this man has pro-BNP of 30,000. So when you have this kind of changes, and on the top of it, you have to be very cautious about the giving fluid, because we are getting those, because he's anemic. These people can easily go into fluid overload. So you have to be cautious about the fluid overload. So it's unlikely because of symmetrical changes. And as I mentioned, if you go back to the first CT, typically, now I'll explain you what happens in COVID CT changes. These ground glass appearance are usually symmetrical, peripheral, and this is the hallmark of the disease. The second thing which you find in COVID is got what you call traction bronchiectasis. Like you get typical, I've already shared a article in the group. So traction bronchiectasis is another thing. Then you can have what you call craving shadows. There's a typical shadows. And also, if you could see here, there are some vascular dilatations here. You see, can you see some vascular dilatations here? I could see. Now whenever you see vascular, these are the vascular. So in between those ground glass, you see this black shadows. These are vascular dilatations. So vascular dilatation, traction bronchiectasis, pleural effusion, lymphadenopathies, but the hallmark is ground glass appearance. Reason I wanted to show you is that whenever you have this kind of an CT with patient present with fever and RT-PCR positive, always get the markers done, and usually they should be given a very aggressive steroidal approach. And you see, it's like totally flared. It's like a forest fire. It's like totally flaring up. So these are the things you should be always be careful. And this patient is in ICU 4, and one can go and have a look. And this is a very interesting presentations, and this is a normal you can be asked in the exam.